Hi everyone, I'm Steve, here again with Dr. Nario. Thanks for being here, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, so we're going to talk about sex hormone binding globule, SHBG. We'll talk about it, but first let me say, if you guys want to know more about what Dr. Nario does, he's at Biointegrative Health Center in Reno, Nevada. You can see what kind of treatments they do, a lot of IVs and a lot of really cool treatments. So you can find out more about what they do there. Just find them online, Biointegrative Health Center. So, Doc, what is SHBG?
All right. So SHBG is an acronym. So the real, I guess, meaning of this is sex hormone binding globulin, and this is something that is of interest for a lot of people, but specifically for hormone patients, meaning the ones who are receiving hormones. Why is that? Because SHBG, you have to remember, is made by the liver, and it's really related to binding specific hormones, as we call it. And this is sometimes we use this parameter to actually estimate the amount of testosterone in the body and even estrogen. And there's so many influences that we can actually talk about in a bit on why SHBG goes up, it goes down, and the difference between men or women is really it's prominent. For example, when you hear about women SHBG binding to hormones, it's not usually testosterone. As I mentioned to you, estrogen and testosterone binds to SHBG, right? And this is more of a dual picture for women. For men, when you think about SHBG, yes, testosterone can be directly related to that. That's why it has different effects for women and men. Sometimes we classify them in one umbrella, but usually we need to draw a line somewhere there. And as I mentioned to you again, it actually is a protein created by the liver in response to specific insults in the body. So that's what we're going to talk about in a bit.
Okay, so if you guys watch the channel, which you're watching now, you probably know I'm on testosterone replacement therapy, and Dr. Nario monitors me on that. So, tell me, because I know all these hormones are important, testosterone, estrogen, and I'll have you kind of give an outline for men and for women because it's equally important for both.
Right.
So, what happens when the sex hormone binding globule, the SHBG, and related to testosterone and estrogen, what happens when that is high?
Okay. That's a good question, Steve. I always want to explain to patients, it's almost a cartoonic explanation that I give them. Is it's like when you play basketball, right? You play one on one. It's like a man on man defense. This is what SHBG does to your hormones. It sticks to every hormone, like for example, testosterone, to prevent it from locking into a receptor so that it won't do its function. It's almost like, yeah, sticky man-to-man defense. And you don't want that. You want your hormones going directly to the goal line. And when you have high SHBG, you expect the symptoms of low testosterone, even sometimes low estrogen, because they're not stimulating the receptors properly. And this is where now the other symptoms comes into the picture. So I don't know if that was kind of an understandable explanation of what the function of SHBG is.
Yeah, it is. And but you're a doctor, and it's easy for doctors to kind of talk over
Right.
our heads sometimes. So
Right.
um, then what I think you're hearing, and I'll just repeat this so that our listeners can understand. If sex hormone binding globule is high,
Hmm.
that is probably going. I know it works this way on my blood work. Then my it's going to affect my free testosterone.
Hmm.
So my free testosterone in this case would be lower if the SHBG is high, correct?
All right. So you have to understand that when we talk about testosterone, when you look at it in a blood test, the total testosterone is what we usually see. It's not what it seems to be, meaning not all of that testosterone is working. Some of them are blanks because here's the actual percent. in terms of distribution. Only 2% are what we call bioavailable, meaning it's the one that you use for the body to move or even be functional with these hormones. The majority of your testosterone is stuck to proteins such as albumin, for example, and even the other part is sex hormone binding globulin. That's why that's how important that is, because you only have 2% functionality of what you have. And that's why the objective here is to lower or normalize sex hormone binding globulin as much as we can. And the highest affinity to this, I was mentioning testosterone and estrogen, right? It's always going to be testosterone. So that's why the men are the one really who are like feeling the effects of this when your SHBG is altered.
Right. So when it's high, it's not binding to the total testosterone. When it's binding to the total testosterone, it's going to lower the SHBG is going to be lower, and the free testosterone is going to be higher. Is that right?
That is right. So that's why our objective here. Some people would say that, oh, I want lower SHBG so it can have high hormones, right? But there are still pathologies that are involved with that. That's why I use the term normalize. You want it in a sweet spot because SHBG has its time and place in terms of functioning. So let's talk about this on what elevates it, what lowers down the numbers for SHBG. So the ideal way that we want it to be is we want low SHBG, right? That's always what you want to hear. But here's the thing. It's not always good to have low HSBG, meaning lower, really low levels. The reason for that is this is now related to the condition called PCOS. This is the women's condition of high polycystic ovarian syndrome. And now if you look at it, that's why they have majority of their clinical symptoms related to androgen excess, like hair growth, mustaches. They have even acne in their face and also irritable. They can't lose weight. And that's kind of like my bar that I set when I say, if you want to think about low SHBG, this is the condition you always think about. And even now, obesity. So it's easier to now correlate these things together. And also people who are using anabolic steroids, for example. Those are also another one. And if you're hypothyroid, you're also going to be manifesting low SHBG. And on the other scale here, high SHBG conditions are now related to liver pathologies, meaning liver damages. And I mentioned to you this is being made by your liver. And liver disease, such as cirrhosis or hepatitis, would actually increase your SHBG. Having an overactive thyroid will also increase the release of SHBG. So that's why where I'm going with this is you don't want to be under. You only want to be in the sweet spot for SHBG.
Yeah, that's great stuff. That SHBG, you want it just right,
Mm-hmm.
because when it's just right,
Right.
all your other hormones are going to be probably dialed in. Is that right?
Yes. So that's why that's something that we really want to get into proper perspective. Just because I always want to tell patients also that SHBG is not just related to hormones. SHBG can be used as a marker to actually assess, for example, metabolic syndrome, diabetes 2, cardiovascular disease. And as I mentioned to you, for example, PCOS, if somebody has that, you can already say that, okay, that patient probably has pre-diabetes or ongoing diabetes because that's a driver of polycystic ovarian syndrome. And we just want to get people out of that box of just relating SHBG with hormones. But now we're talking about other parameters and how this can be useful clinically to help our patients.
So, what can we do? Is there supplements we can take, or what do you do if you have a patient? You can do man and female. If
Mhm.
their SHBG is high, what do you do?
So you have to remember the reasons why they're high, right? So let me just again tally that up again for you. Liver. If you have bad liver conditions, these SHBG numbers will go up. If you have inflammation can actually stimulate that liver to create more SHBG. And then also people who are on oral hormones such as estrogen, that stimulates a lot of SHBG. This is also related to the thyroid. A hyperthyroid state will increase the production of SHBG. And aging. As we age, we actually will see these numbers go higher and higher. So treating the root cause will be actually one of the better methods in approaching SHBG. So treat these specific conditions, then you will definitely have a better, I guess, outcome of controlling your SHBG. But for us, we have our own like tricks of our trades. Boron is something that we definitely use a lot of in this specific condition. And I'm sure you have a lot of questions about boron.
Yeah, boron is a very popular topic on this channel. We were saying that before we turned the recording on. Um, like I take 5 milligrams a day
Mhm.
and kind of cycle it because I know you're not maybe supposed to take it all the time. But I also know that you guys have all kinds of treatments that you do in your clinic
Right.
if to treat the liver.
Mhm.
Um, Plaque X, liver cleanses, glutathione. I mean, all the fun treatments that I get when
Right.
I go there. If you're, but see, it's the other blood work is also going to tell you, okay, the SHBG is high. Here's why. It could be a liver issue. So now you can treat the liver specifically because you know that's high. That's what's making it high, right?
Correct. And then the thing there is, you mentioned about the liver. That's also where I was going a while ago. Fix the problem. You can't give boron even though you have a liver issue, because you know that sometimes boron will now having a hard time doing its function, and helping it offload the task by fixing that liver will be better. But of course, regardless of such, we still give boron. So we all know boron is a natural mineral, right? Found in soil, water, certain foods, and it's actually required by our body for biological functions. And we hear a lot about this about not only in the hormone world, but also bone health. And when we say what is the function that makes boron effective in lowering down SHBG, so it actually was what we call lowers down the inflammation of the body. So the inflammatory markers that the body creates stimulates that liver to create more of the SHBG. So that's why when I mentioned boron, it has an anti-inflammatory effect, specifically to the liver and also the enzymes that are being created. And also another one is, as I told you, when SHBG is connected to your hormones, it cracks it open, separates them. So now you can actually use that hormone, may it be testosterone or estrogen, now for your cells, because now they're actually cracked open and swimming around the blood freely. And another one would be there's what we call some genetic modifications that it actually now lowers down the expression as more of a genetic level. It lowers down the expression of the liver in production of SHBG. So this, when you mentioned about your dosing, 5 milligram, yes, the dosing would be depending really on how severe the SHBG number would be. And with 10 milligrams, that's 5 to 10 milligrams is an average of a patient. In our practice, we actually make these patients use boron for at least a month, and we do a blood test to see how the SHBG is responding. If it's normal, we don't even have to be on boron for a long time.
And so you mentioned that boron is not a direct treatment for the liver. So when would you use boron in this situation if the SHBG is high? When would you choose to use boron because there's inflammation there? Is that why you would use it?
Well, with boron, as I say, it's basically a must-have, regardless of a patient having liver condition, for example, or thyroid problems, and their SHBG is high, right? So,
You're always going to use that. You're saying you're always
yes,
going to use
it's
boron.
always going to be there's always going to be boron in that protocol. And of course, now the one that will be changing will be how would you address a dysfunctional liver, or how will you address a dysfunctional thyroid? So you won't go wrong with boron, but at the same time, you need to have the root cause therapy on where it's coming from. It's like your boron can be your soldier in the field, and your general is like hiding in the base who's thinking of all these tactics, which is the main heart of that attack plan.
Okay, so what else could cause the SHBG to be high
Mhm.
or low? And what other protocols would you use give us some examples of other protocols that you might use to correct it.
Well, really, Steve, it's all about. mm, there's a lot of environmental, external, and lifestyle factors here that contributes to the increase of SHBG. If you think about it, sometimes it's even self-induced. Unfortunately, when I talk to you about contributing factors here, a good example would be coffee consumption. The people who drinks a lot of coffee actually has an altered SHBG level, and then also when you're talking about people who has high cholesterol, that's also one other. It actually was related to high triglycerides and even LDL and even CRP, which is another inflammatory marker that we use. Another one, people who are having sleep apnea issues, the ones who are using CPAP. So majority of these problems are, sure, there can be anatomical, but weight. If we lose weight, we actually have better outcomes for sleep apnea, thus lowering down SHBG levels for us. And again, when I mentioned about aging, of course, we can't stop aging. Who can stop aging? Nobody can. The only thing that we could do is we can make a better path towards aging, a healthier way towards aging by fixing our diet, lifestyle, and exercise habits. And as I mentioned to you also, there are external factors that can contribute to this. When women, for example, are using oral estrogen for sure, 100%, you're going to increase that SHBG. So with these women that I work with, I always opt when I use BHRT or hormone therapy on them, creams, right? Creams are better, and or even patches. Those are better alternatives. As you can see, so many factors that contribute to SHBG, but you always have to remember, fix the root cause.
Okay, that's great information, Doc. So, is there any last tips or suggestions that you would give us? Maybe something I didn't ask. I'm asking kind of from one perspective, a
Right.
TRT perspective, but any other important things for our audience to know about SHBG and treatments and so on?
Right. So my message to our viewers here, that let's remove that one label use of SHBG. It's not only for hormones, but we always want to use that also as an indication that, hey, it's all about cardiovascular disease. It's all about even glucose regulation. It's all about ongoing inflammation in our system, and that's why we need to get that cover in our eyes to actually see, wow, there's so many things that SHBG is telling us that there's a problem in our system that we need to fix. And even not only for viewers, but also our doctors. We need to make sure that they get educated about this through us, through us as patients. We tell them about this so they themselves can get a little bit more of education about SHBG.
Now, you mentioned real quick, I just thought of something. It
Hmm.
can be too low. What do you
It
do if
can
it's
be.
too low?
So it can be, so the reason when it's too low, you need to find the cause. It's not like you want to raise that, right, and give an equivalent of boron to increase it. So let's just go back to the reasons why there's low SHBG. One of the reasons would be PCOS. Fix that PCOS problem. Or another one would be obesity. So now you need to lose weight so that you can actually have you can actually have the ability to normalize your SHBG again. And then thyroid problems. Fix that thyroid problems again. So even hyperinsulinemia or the pre-diabetes, fix that. That's why when it's low, it's not something like when you have a problem of high, you give a boron. For low, it's a little deeper. It's a little bit more complicated of an intervention because you need to go for that root cause.
Right. Okay. Well, as always, we appreciate your input, Dr. Nario, and thanks for being with us.
Well, thank you, Steve, again for having me. As we all know, that knowledge is power. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.